We go on to the next speaker, Dr. Harsha Chandran IgG4, the new kid of the block.
Good afternoon to everyone on and off the dais. My topic is IgG4, the new kid on the block. I am Dr. Harsha Chandran and my guide is Dr. P. Modini. IgG4 is a multi-organ fibroinflammatory disease with tumefactive lesions of unknown etiology. It is associated with elevated levels of serum IgG4, and the hallmark of this disease is a dense lymphoplasmacytic infiltrate with IgG4 positive plasma cells. Due to a lack of systemic approach, this disease is usually underdiagnosed, and the predominance is more in older males in the 6th decade, with the most common organs involved being the pancreas, the kidneys, the orbital adnexal structures, salivary glands, and the retroperitoneum. The orbital and ocular manifestations include lacrimal gland involvement, a painless unilateral or bilateral proptosis, periorbital swelling, erythema, and all. The 2020 revised comprehensive diagnostic criteria for IgG4 related diseases have 3 points: clinical and radiological features, a serological diagnosis, and a pathological diagnosis. The clinical and radiological features were consistent with swelling of any organ, one or more, serology showing higher IgG4 levels, and a pathological diagnosis. The materials and methods involved in this case, there was a 40-year-old female who had presented to our OPD with complaints of outward protrusion and periocular swelling of the lids of both eyes for 2 years. It was gradually progressive and painless in nature. She also had noticed swelling in the parotid and neck regions at around the same time. She is a known case of hypothyroidism on treatment with thyronol 50 microgram for the last 5 years. There is no other significant history as such, and since general examination had showed a swelling in the sublingual, submandibular, and bilateral parotid regions, an ocular examination showed that both eyes were proptosed with diffuse periorbital swelling and a best corrected visual acuity of 6/12 in both eyes. Anterior segment and fundus examination was within normal limits. Extraocular movements were full and free with Hertel's ophthalmometer readings of 24 mm in the right eye and 23 in the left eye. The patient had presented to us with an MRI film which had showed thickened recti, oblique muscles, and bilateral proptosis, and this had been done outside. So based on the clinical findings, a professional diagnosis of Mikulicz disease, IgG4 disease, and non-specific orbital inflammatory disease were made. Lab investigations were done and which showed elevated levels of IgG4. Eosinophilia was noted on the complete blood profile. Mantoux test was negative. The thyroid profile was normal and no abnormalities were detected on chest X-ray. Further, an FDG PET-CT was advised to look for any other active foci of inflammation or the disease, and it showed uptake in salivary glands, cervical, mediastinal nodes, lung changes, and foci in the pancreas also. So sublingual gland biopsy was done under LA, and histopathology revealed tiny fragments of stratified squamous columnar epithelium, which was consistent with the mucinous gland. And a diagnosis was IgG4 related disease was made. The patient was started on glucocorticoids like 10 tab prednisolone 15 mg per day, and she was referred to a rheumatologist for further evaluation. So after 1 month of steroids, the periorbital swelling and proptosis had come down. So IgG4 related disease is a unique clinical entity, and thorough evaluation is required for us to reach a diagnosis. Clinching a diagnosis of IgG4 related disease is often challenging due to subtle and varied ophthalmologic and systemic presentations, which will be missed if we don't look for it. And we have also sent the blocks for an immunohistochemistry because we couldn't find any IgG4 positivity in those samples. Thank you.
Thank you very much. Very well documented, and you have worked up the case so well, and that's why you could actually target the disease. So one thing that I would really want to say is that they usually present with very painful, IgG4 is usually painful IOID. Did this patient have severe pain?
No, she didn't complain of any pain of such.
All right.
Yes, ma'am. And it's been over 2 years, so I don't know if she had pain in the beginning or not. She has not complained of any pain as such.
Okay, very good presentation.